everyone. Welcome to another Talkative session. Today we have with us Dr. Manali Grover, BPT, MPT, a consultant physiotherapist of Health Leaf Clinic, Delhi. She's a certified women's health and pelvic floor physiotherapist. She's also a certified childbirth educator and a prenatal. Firstly, thank you so much, Manali, for joining with me today in this conversation. I think that it is going to be extremely helpful to be able to bring out the healing effects of physiotherapy from a doctor's point of view as well as from a patient's point of view. I would also like to extend a big thank you for being an instrumental part in my recovery post my hospitalization of my critical illness. And I think a lot of learning can come out from why physiotherapy is important, especially when you are undergoing a critical illness recovery or trauma recovery or an injury recovery. And I think I would like to spend a lot of time talking about the physical and mental aspects of both the healing effects of physiotherapy.
So I want to thank you for such a wonderful intro. And yes, it is always a learning experience for me when I see a new patient. And yes, please start.
So my first question, and I think this question is on the mind of many people, who are wanting to get into a physiotherapy session. Why do
Yes.
you think it's important to opt for targeted physiotherapy sessions rather than free online available resources that are there for physiotherapy? Why do you think that opting for target physiotherapy sessions is more effective than the free resources that we get online?
Yeah, a very good question. And so, as you said, there are resources, and they add to your therapy. It is not physiotherapy. So the exercise, like 5 beneficial exercises for low back pain, anything which you get online, are guidelines, and they're not for everyone. They are general. They're not specific. Okay, they may help you, but for each case, there would be specific treatment which is different. Okay, and which can be delivered to the patient after a proper assessment according to the needs of the patient. There cannot be a general treatment. There could be a general mobility session, like general exercises for well being. That is possible. But if somebody is having certain problems, a certain problem, then they require to get it assessed and then get it treated. The specific targeted treatment is very important. And yeah, you can use those resources as a reference point. You can refer to them so that you can be regular with your exercises. You can stay motivated, and you know, okay, I'm not making a mistake. So you can use these resources as a reference tools. But I should not think you should just start watching even if you online videos and start doing your own treatment. That's not the way to go about. Yeah, certainly not. Yeah.
I cannot agree more on this, Manali, because I think two of the things that worked beautifully for me with targeted therapy when we were doing the targeted physiotherapy sessions.
Yeah.
One was, I think, when you are looking at targeted physiotherapy, you have specific goals defined, right? In
Yes.
my case, when we were discussing,
Yes.
I remember when we started doing the physiotherapy, the first thing that you asked me was, what is it that you want to achieve from this session?
Yeah.
And
Yes.
I remember telling you that, no matter what kind of exercise that the whole regime entails, I would want to be able to drive my car and I would want
Yes.
to be able to cook.
Yes.
And the targeted physiotherapy was actually targeted towards ensuring that I'm able to move my body in a
Yes.
manner that I'm able to sit in a car and drive, and I'm able to stand in the kitchen and cook. And
Yes.
I think that really helps because for me, it was very clear that we are not doing everything in the world when it comes to exercise. We are doing very targeted exercise because we want to achieve a certain target or a certain goal. I think that was definitely helpful in terms of having targeted physiotherapy. And I think the another thing is, How do you know that you do it right if you don't have a targeted physiotherapy, right?
Yes.
Any social media video will be able to help you learn and understand how do you do it, but there is absolutely no feedback on
Yes.
what you're doing is right or wrong.
Yes.
And
Yes.
I think, especially when you're healing from a critical illness or when you're healing from an injury, it's extremely important that you're doing the exercise in the right manner, the right amount of pressure, the right amount of iterations of doing it. I think all of
Yes.
that matters.
Yes. Yes. How do you do it? Which muscles you are using? If you're adopting the right posture or no. And also the speed and also your body awareness. If you're using the specific muscle in the right way.
Correct.
Okay. If you're not, then that makes you prone to injury, which we don't want, right? So it is very important that you have targeted sessions, and as you said, which are goal specific, which could be different for you at different times. For you, initially, it was to be able to cook or drive, and then when you started walking, your goal changed. You want to do Surya Namaskar,
Correct.
right? It changed, and we then change the session according to the goal which you were looking at. So for
Absolutely.
Surya Namaskar, you need good mobility in your back, in your knees. So we were focusing on the joints, on the movements, which will help you to achieve your goal. So also you were very motivated since it was your goal. So it helps in that way also, right? Yes.
Absolutely, absolutely. And I think that's how it worked for me. So I am
Yeah.
definitely pro for having targeted physiotherapy sessions because it has naturally worked for me.
Yes.
Another question that has been on my mind from the time that we started physiotherapy was, how does it affect a patient's mental well-being? While we understand that physiotherapy is highly focused on the physical aspect of a patient, um,
Patient.
firstly, does it affect the mental well-being, and if yes, how does it affect? What are your thoughts on the physical and mental connection of healing with physiotherapy?
Hmm. So, see, mind and body is one unit, right? And I'm sure you know about biopsychosocial model. So, your biology affects how your mental well-being, and in the society or an environment you are in. Everything is interrelated. Nothing is like independent of each other. All work in synchrony with each other, right? So, of course, your physical well-being is related to your mental well-being and vice versa, both the ways. So many a times, when somebody has a chronic illness, although their tissues have healed, right? Their tissues have healed, but still they are not confident because that area, or that part has been injured or not well for such a long time. They have lost the confidence, and even if the part is healed, they still feel pain in that part,
Yeah,
right? So there's a concept called a central sensitization for that, but it is all linked, and to convince the patient that it's not just okay. It's not the patient is thinking that there is pain. Actually, the patient is feeling the pain because that part has become sensitive.
correct.
Same thing with chronic illness. So it's not only about making the patient stand up or making the patient do the specific exercises. Also understanding what is going on in patient's mind. What is a patient thinking about it? What is the connection level with that muscle? That muscle may have a small stimulus from that muscle, from that injured area, and it's enough to start the spasm cycle again. So we have to understand the thought process, the emotions of the patient, along with the physical side of it. So yeah, definitely it affects. It is both mental well-being and physical well-being. I feel they affect each other in a huge way. And see, if I give your example, when you were standing, when you were up and about, you suddenly progressed very rapidly, right? Your infection subsided, your breathing got better, you were able to walk, and even the you were getting repeated chest infection. Also, the frequency reduced.
Correct.
when, when you were exercising. Okay, so definitely there is a correlation between your mind and your body. And as a physio, I think we need to appreciate both. We need to focus on both and not only on physical well being.
I'm absolutely with you on this. When it comes to the connection between the mental well-being and the physical well-being, because it has worked that way for me.
Hmm.
Most of the time we talk about I'll do this when I'm motivated,
Yeah.
and unfortunately, it never works like that. Through
Hmm.
my entire physiotherapy sessions that I have gone through, what has worked for me is I'm motivated after I do it. So the first thing is to do it, then
Yeah.
create that motivation, because when you see something being achieved, when you see that you're able to do something, that action motivates you basically. And
Yes,
I
your own victories, your last victory is your biggest motivation, right? A
absolutely
small victory, small
and like
victory
you said,
in recovery.
true. And like you said, that the day I got up,
Yeah,
I think that was a big motivation for me, because I did something which
yeah.
was part of the targeted physiotherapy. I was motivated to continue to doing it,
Yes,
and probably do a little bit more.
yes,
But I couldn't be lying down on my bed and just wondering that I'll do one more exercise after I get motivated, because it doesn't
yes,
work that way.
yes.
And having said that, I also feel that sometimes when you're too determined to do something,
Hmm.
you stop being kinder to yourself.
Hmm.
You stop
True.
listening to your body, and I think that is also important when you're
Very
going
important.
to a
To
physiotherapy.
listen to your body,
To listen to your body. I remember
communicate with your body.
there were so many times when we were going through the physiotherapy session, and you repeatedly told me that do only what you can, don't go ahead.
Especially in online sessions, it's
Correct.
very, very important that you are connected to your body and you listen to your body.
True.
That's very important. Always, but more in online sessions, I would say. Yeah.
True. And I think it became easier for me the moment I started listening to, my body is trying to tell me to stop at a certain point. Okay, you've done three iterations now, take a break, take a deep breath, and then
Yeah.
continue. I think it's very important, while you are determined to go ahead and motivated to do things in physiotherapy, it's important that you are able to listen to what your body is telling you. Sometimes your brain is telling you to just, take it slow. Sometimes your brain will also trigger you and push you to do one more, because you can do it. And I think that connection between your physical aspect of the body and the mind, if you're able to establish that, it really helps. Another
Hmm.
thing, since you're talking about mental well-being and physical well-being both together, I think what really was effective for me was our stretching sessions. I think the whole time during the stretching session, it felt as if I was releasing stress from my
Hmm.
body.
Hmm.
And I remember going back after the session. I was on that yoga mat and I was sitting there for about 5 minutes, just
Collecting.
engulfing what had happened.
Your mind and body is definitely connected.
I just figured out that just stretching your body, which is a strenuous exercise, which is not something that might not tire you. It does tire you,
Yeah.
but if you can feel the stress and the pressure and the anxiety release out during
Yeah.
that stretching
Yes.
session,
Hmm.
I think then your mind and your body are really connected when you are
Yes.
doing physiotherapy.
Focusing is very important. And
Yes.
also, I would like to add here, as a physio, it's very important to see which muscles the patient can stretch and which movement the patient should not be doing according to the injury or tolerance level of the patient.
Correct.
Right? Monitoring is also very important, especially in initial stages of recovery. Like when we first time we made you sit, we were always monitoring you. We were
Correct.
seeing kitna hai SpO2. We were monitoring you initially when we were trying this movement for the first time. Once your body got used to it, then we slowly said, listen to your body. So first, it's very important to monitor initially when we are doing, because yours was a very chronic. You were on bed for a very long time, so it's very
Correct.
very important to slowly step up the rehab and not suddenly do it, and see as a physio I'm telling you, and to see what is the tolerance level of the patient, and then slowly prescribe very guided exercises, and then make sure that the patient is connected to their body,
Correct.
you know and that also is very different. Everyone body awareness is different. You
Correct.
had a good body awareness, you knew, okay, this muscle is tight. You were very, I would say, if I would tell you something, you would understand it pretty fast.
Yeah.
It depends on that also.
Correct.
When the patient If the patient is able to take the instructions very clearly, or the patient is taking some time, so according to that also you have to change your speed, and the level of the time duration you're taking for each exercise. You just can't hurry, because every patient is different.
True. I think that's a very important point that the way physiotherapy works for everyone is different.
And sometimes, see, when you got up for the first time, I still remember when you got up, it wouldn't have been possible for you to get up straight, since you do not have a very strong abdominal strength that time. But I asked you to turn on one side, and then it
Correct.
was so easy for you in an online session with no help.
Yes.
So it
Yes.
was basically just a movement which made the sitting possible. And once you sat down, you were like, wow, I can do this, right?
Absolutely. Absolutely.
Just teaching the patient the way they can do it easily according to
Correct.
their problem is very
Yes.
important, which may
Correct.
change according to the
Which
condition.
I do remember that when we were doing some exercises, they were not happening for me at that point of time. And you said,
Yeah.
we'll revisit this later on.
Yes,
That
yes,
maybe you're not ready for doing it right now, and
yes,
we'll revisit it later on. And when we revisited it about 10-15 days later,
yeah,
we were able to do it at that point of time. So you're right. I think the right exercise at the right time is also important
yes,
to
right,
be focused on.
yes, yes.
Okay, great. There's another one more question that I really want to ask you, and this is specifically because, um, when people ask me, you've been doing really great within a year's time of recovery, and who is your physiotherapist? And when I tell them that I did my physiotherapy online, I get reactions that I've not seen ever in my life, because I think it's very difficult for
Hmm,
anyone to believe the kind of improvement that I've had from a
hmm,
bedridden state to being
hmm,
able to do almost everything with a normalcy effect.
hmm,
And people find it difficult to believe that this has happened online, because
hmm.
physiotherapy is supposedly to be considered uh,
Offline,
an
in person.
offline concept, where
Hmm,
the doctor has to be present and the doctor has to be able to make your hands, legs, muscles move.
hmm.
And uh, and I really wanted to bring this out because I wanted to talk about the most important aspects of how online physiotherapy works. You know,
Hmm,
what, according to you as a doctor,
hmm.
works in an online physiotherapy and what doesn't work? What is it that people should keep in mind when they are picking up a targeted online physiotherapy session?
So for me as a physiotherapist, I would say the most important thing is, see, I won't say that everything can be treated online. That's not possible. Okay, there are some cases which you have to see offline or in person, and they cannot be seen online. But a lot of cases, now can be seen online, and sometimes with initial first assessment, which is offline, and later it can be continued online. But sometimes that is not possible.
Right.
Then the only option is left is online. So online, there are certain things which we need to keep in mind. First thing is, I think initially, if the patient is especially like chronic illness or bedridden, we need someone with the patient.
Right.
It, even the patient needs to have a helper or anyone attendant near the patient, so
Some
that
caregiver.
some caregiver initially, whom the therapist and the patient, can coordinate with,
Right.
right? Then clear view. basic technical things, clear view, which is also very important. The where you keep your mobile so that you can see the patient properly. So planning that beforehand. This is the simple things, but make a huge difference where you keep your mobile beforehand so that the therapist can see the patient very clearly, the physiotherapist. And even the patient is confident the therapist is seeing me clearly and can demonstrate the movement which has been prescribed. Also, I think for me, one more thing, I don't know if everyone will agree, experience of the physiotherapist also matters. When you know, okay, in this condition, patient may have this problem. So you already know. So, that also helps. Experience in treating similar cases. So I think that helped me a lot. Since I had experience, so online made it easier for me. And also, I think it depends on the patient also, not only on the physiotherapist, also on the patient. How motivated is the patient? Very important.
True.
You are very motivated. Definitely, you were very motivated from day one. You wanted to get out of the bed.
Yeah.
That made my job very easy, frankly.
True.
If you were not motivated, then it would have been a very challenging thing online for me to get you to. You were very motivated, right? Also, whatever instructions or whatever I told you कि ऐसे करना है, you were very easily able to understand it. You didn't take much time. You're very quick in that sense. Sometimes patients take time,
Right.
so maybe we saved on that, time factor. You were very quick and you were very attentive and you're always motivated and you really followed up. You really made the effort. If I used to tell you ये करना है, तो you used to do it. Next time when you used to come online, you were like, yeah, मैंने ये सब कुछ कर लिया. I have done this. I never heard नहीं, I was lazy. No, I never heard that from you. You were regular. You didn't skip sessions. So even any day you were not feeling like doing the sessions, you pushed yourself. I saw it. You pushed yourself. So, because
True.
you're motivated.
Correct.
And that's why I think you recovered the way you recovered. Online physiotherapy is possible, especially when you cannot travel and you stay
Yes.
long distance. Then I think instead of not getting therapy, it should be done. It is very helpful, and I highly recommend it. It should be done. Only when sometimes machines and everything is involved, that may not be possible online.
I
Right?
think
Yes.
it was a big boon, the whole
Yeah.
online physiotherapy, because the first and the most important thing for me was being away from infections. While the doctor kept, focusing on the fact that nobody should come home, you should not have visitors, it was
Yeah.
becoming a challenge for me to have a physiotherapist coming every day at my home, and which just increases my risk of infection. So I think
Yes.
if you are infection prone or
Yeah.
infection susceptible, that is one of the best methods to go in for physiotherapy, because that clearly cuts off that area of concern for you. The other thing that really worked for me was you were able to instruct me well. If I'm not understanding a certain thing, you had a manner in which you'll explain it to me in other ways, right? That if I'm not understanding what muscle is it, you'll try and explain it to me that, okay, can you pull your leg, and then you see that muscle moving, that's the muscle that I'm talking about, right? So I think the way that the instruction is given to the patient on in an online methodology is extremely important. So I think that's one very important aspect, one very important skill that you have, that you were able to instruct me so well in the whole physiotherapy session, that I was able to pick up, understand that this needs to be done, and this is how it is to be done. Another wonderful thing of online physiotherapy was that I was able to record myself, send it out to you to see whether this is,
Yeah.
ones that you can't see
Yeah.
in an
Yeah.
online setup.
In a close-up view, you could record and send. That really helped. Yes.
Correct. So now then you can give me a feedback that this works or this doesn't
Huh.
work.
Yeah, that really helps.
For me, I definitely feel that the advantages of online physiotherapy are more. But like you said, I was very privileged. I was lucky that I did not need any major instruments or equipments
Yeah,
for my
yeah.
physiotherapy, because then that would have been one drawback which I feel that the offline physiotherapy really helps. Of course, there are some things that a doctor can see and tell you that this is what needs to be done, or this is how we need to
Yes,
go about.
sometimes. Yeah.
Sometimes you need that, but
Yes.
disbelief about the fact that online physiotherapy may not work. I think I'm a living example that it works, and I would really encourage people to utilize this when you don't have the option of an offline physiotherapy.
Yes, yes. I think it's very important for the patients to be told about physiotherapy and to be referred to physiotherapy, when they need it, because many a times they're not aware. A lot of people are
Right.
not aware, and they don't know what exactly physiotherapy means. Exercise ही तो है, तो they think why, what, how it,
Right.
but when you take it, है
Correct.
ना, this is what helps us to get up, to become mobile again, to rehabilitate, to get fitter after injury. So it is very important, and so that's you have, yeah, and I think I'm sure because it has helped you, you can definitely recommend it to others.
Absolutely. I have no doubts about the fact that physiotherapy has played a very instrumental part in my recovery. And I think it also helps you to become more confident. It helps you to become more independent. And I think once you become independent, a lot of your fears, a lot of your anxiety is under control. And
Sandhya.
it's more about being in control when you're able to do things after going through physiotherapy session. That being in control feeling is an amazing feeling to have, and I've had that, and I can vouch for the fact that if you're going through uh, healing from an illness, or you're recovering post hospitalization, no matter what injury or what illness you have gone through, mobility in the body is extremely important,
Extremely
because that
important.
is going to reduce half of your problems,
Mm.
whatever they may, whether you have a lung
Yes,
problem, you have a stomach
yes,
problem, or you
yes,
have any internal
definitely.
organ problem. And I had all of them too when
Yes.
I was bedridden. So for
But you
me,
also, I should say, you have been extremely brave and you have kept yourself motivated throughout. And now you should share your experience. You are, I've seen your videos, you're already sharing your experience and motivating others who may need it now, who may be sailing in the same boat and maybe needing it now. They will definitely be motivated by your experience. Yeah.
absolutely. And I think that is why I wanted to connect with you, because I really wanted to bring out the importance of physiotherapy, because it has been a crucial aspect
Thank you so
in my healing.
much.
And post this video, I am going to share the details of Health Leaf Clinic for everybody who can benefit from online and offline physiotherapy. If you're in Delhi, great, you can go and get the offline physiotherapy done. But if you're not, and there are travel constraints, then I think it will be a great help for you if you can get through online physiotherapy with Health Leaf Clinic. Thank you so much, Manali. This has been a great conversation. We always have great conversations when we speak,
I agree.
but
All
this was needed, because I really wanted to create the right kind of awareness about how physiotherapy can have healing effects when you're recovering.
Thank you so much. Thank you for inviting me for the session, and I really enjoyed, as always, speaking with you. And please share your experience with others and keep shining like you always
Thank,
do.
thank you so much, Manali. Thanks.
Most welcome.